Namaskara. I'm Dr. Sunita Rana Agarwal from Dr. Agarwal Hospitals, Bangalore, and I'm an ophthalmologist as well as I do genetic medicine. Simple things, palming, take a cup, katori or anything, put little mineral water in it, wash your eyes. Whenever you come from outside, wash your face and your eyes. Use sunscreen. Definitely use a pair of sunglasses when you're going out in the sun, and use sunscreen liberally when you're going out in the sun. Other than that, we'd like to go back to some of the exercises. Put tea bags on your eye, cold compress, that is, focus shifting. So look at 20 feet distance, look back here. Look at 20 feet distance, look back here. Or the 20-20-20 rule if you're sitting on the computer. Video display terms are a common cause of eye pain, and you need relief on your table. You can keep your artificial tears there. Use your 20-20 rule and put one drop every 2 to 3 hours in your eye, so your eyes get moistened. Most important, use an ointment to rub your lash margins, so all around you have good moisture. Natural remedies work far better. So here we'd like to insist on a good diet. So green leafy vegetables, carrot juice is supposed to be very good because it has a good content of vitamin A, omega-3 fatty acids, which comes from your fish and eggs, and some other meat products. But if somebody is a vegetarian, then you can go to tofu and paneer, which is very good in protein. I recommend to use these. Of course, you can always go into the pharmaceutical world and collect your vitamin A, C, E, omega-3 fatty acid, cod liver oil. All these are very good to keep your eye pain, eye strain at check. Along with that, few simple exercises for the eye is making a figure of 8 with your eye and then moving your eye up and down in all kinds of directions, and the 20-20 rule where you look away and distant. These kind of mechanisms pull out in a long run. When we want to go on a fast track, what we do is we would definitely need to put a silicone plug and give the patient an injection, as well as diode laser upon the retina. What does the diode laser upon the retina do? It simulates the sun. We're using a very low threshold, 50 millijoules of energy, and this is just scattered upon the retina. This simulates the sun. The silicone plug, we brought water back into the eye, and the DNA injection is the best manure for the eye. So if we have a plant that is going down and we give the 3 things back to the patient, obviously the plant also comes up. Sunlight, water, manure. Here the sunlight is the diode laser, the water is the silicone plug, and the manure is his own DNA. Cold compress definitely for eye strain and anything which does not have an infection. How do we differentiate that? Is if in the morning when you get up and your eyelids are sticking together, that means it's bacterial contamination. This is infection. At this point is the only place in all of medicine that we would like to give you hot compress. So we'd like to take you take an iron box, take a kerchief, make your kerchief warm, hold it onto the eye, go back and use antibiotic eye drops, eye ointment, and hot fomentation. Screen time will always make it worse. I need to tell you a little thing which I found out when I was studying in Chennai. There is a book over there of 1857 where the blink reflex per minute is more than 25 blinks in 1 minute. By the 1900s, it had dropped to 10 to 12 per minute because of the printing and the newspapers. But today, with our computer, screen time, video display terminals, television, mobile phones, it has dropped drastically. If you want to check a friend of yours who is also working on the same station with you, but don't let them know, and check how many times in a minute they blink. Most likely it will be 0 to 1. 1 blink in 1 minute. So what is it doing? The tear film needs the blink reflex to keep on forming the integrity of the tear film. The tear film breaks up in about 10 to 15 seconds max. Usually in today's world, because of our dry eyes, the mucus is breaking up in less than 2 seconds. So we close open, there is already a break in the tear film. The tear film is also important for us for vision. It's also important for us for hydration. So it's hydrating our corneas. This way, if we have not got the tear film back with us, let's treat it. There are two ways to treat it. We can treat it naturally by doing the eye exercises, palming, putting tea bags in your eye. But when you want to go on a fast track, then we need to put a silicone plug in your eye. We want to give you injections and do the diode laser. This way, we've popped up the eye in a much better format. If you are not being able to be helped within the hour with these natural methods that I have just enlisted to you, cold compress, tea bags in your eye, etc., then it is high time that you go and see a doctor. Let them say there's no problem, but we do not want to leave any stone unturned for a bleeder in the eye, for a retinal detachment, age-related macular degeneration, stroke, diabetic retinopathy, glaucoma, cataract. Any of these more serious conditions requires an eye surgeon.